some of the photos from past modules, okay, na siya yung largest. And majority of its branches are sensory in nature, okay? And only the third branch, later you will see what is the third branch, okay? Okay, so the third branch has the motor innervations. The rest are all sensory. So these are the objectives for this module. One, you are expected that at the end of this module, you'll be able to outline the division of the trigeminal nerve and its branches. Number two, identify the nerves innervating the structures of the head. And number three, correlate the importance of the branches of the trigeminal nerve supplying the oral region, okay, to the important to the field of dentistry. So some of the words later that I will say, like what part it innervates, you really have to take down notes. Okay, so this way you will really listen, okay, for the lecture. So the trigeminal nerve, okay, is actually situated outside the central nervous system. And if you go back to the anatomy of the central nervous system, okay, you have, I hope you remember, okay, the last part where the midbrain, pons, and medulla is. So the trigeminal nerve originates um, from the three parts of the central nervous system, okay, and it is from the four different nuclei, and three of which are already on the screen. So we have the mesencephalic nucleus, your principal sensory nucleus, and your spinal nucleus. So all these three are sensory in nature, okay, and as it joins together, wait lang, I have to admit someone. Let's continue. So as it merges, it forms your trigeminal ganglion, okay, which we usually call as your trigeminal nerve or your cranial nerve number 5. And this ganglion, so when we say ganglion, this is a collection of the nerve cell bodies outside the central nervous system, okay? So from this trigeminal ganglion, we have cranial nerve number 5, 1, 2, and 3. Okay, so these are just the shortcut. Okay, but on your quizzes and exam, you have to name this V1, V2, and V3. So what are these three major branches? Okay, can you see the screen? Nag-move naman ba? Hello?
Yes po.
Alright.
Kita po.
So this is the trigeminal nerve. Your cranial nerve V1, okay, I hope you can see it. This is your ophthalmic nerve, the green color on your screen, okay, and then pointed by ophthalmic nerve V1, okay. So that's V1, and then we have V2 or your maxillary nerve, okay, and your V3 or your mandibular nerve. So we will have a walkthrough per branch of the trigeminal nerve. So let's now go to V1. So V1 has three major branches: your frontal, nasociliary, and your lacrimal nerve. Okay, so all of these nerves are afferent nerves or purely sensory nerves. Okay, and with regards to the general overview, what are the structures it innervates? We have the forehead and the scalp. We also have your frontal, ethmoid, and sphenoid sinuses, the upper eyelid and its conjunctiva, the cornea, the dorsum of the nose, the lacrimal gland, and some parts of your recurrent tentorial area or region. Okay, so later we'll see what are the branches that innervates these parts. Okay, so I provided you a summary table. Okay, so as I said, there are three main branches of ophthalmic division: the frontal, the lacrimal, and the nasociliary. So for the frontal nerve, okay, this is the largest of the three branches of cranial nerve V1. Okay, and you have two sub-branches. The supraorbital, which innervates your upper eyelid and conjunctiva as well as your scalp area. Okay? And whereas for the supratrochlear, it innervates the same with the supraorbital, it innervates your upper eyelid and conjunctiva. But the difference is the other part it innervates is the forehead region. Okay, so in the photo on your screen, medyo maliit, no? But I hope you have some atlas with you also that may be helpful while we're doing the class. You can open your atlases, okay? Para mas readable on your end. So, again, the frontal is the largest of the three branches, okay? Now we go to the lacrimal. So, the lacrimal is the smallest. Kung may largest, syempre may smallest. So, smallest of the three branches of your cranial nerve V1. And it receives branches from your zygomatic nerve, from the second branch of the trigeminal nerve. Okay, so magjo-join lang siya, okay, sa zygomatic nerve. So later you will notice pag nasa zygomatic nerve na tayo, okay, how it looks like then. And because as it joins with the zygomatic nerve, it contains some parasympathetic fibers. So the lacrimal gland produces the tears, okay, that we produce, or when you are sad, etc. Okay? And what causes the formation of your tears will be a function of your parasympathetic fibers. Okay? And it innervates obviously the lacrimal gland, the upper eyelid and conjunctiva. Okay? And again, it contains parasympathetic fibers to the lacrimal gland. So those are the first two branches. So yung last branch for the ophthalmic division is your nasociliary. It has four sub-branches: the anterior ethmoid nerves, the posterior ethmoid nerve, okay, the infratrochlear nerve, and your long ciliary nerve. So the following also are the branches it innervates. So ang distinct dito sa branches na to will be the posterior ethmoid nerve, where according to studies, 30% of the people does not have a posterior ethmoid nerve, but some does have it. Okay? And please take note of the innervations. For the infratrochlear nerve, it innervates the bridge of the nose, the upper eyelid, and your conjunctiva as well. For the long ciliary nerve, it innervates the majority of the parts of the eyes, your cornea, the ciliary bodies, and the iris. And it contains sympathetic fibers, okay, that causes dilation to the pupilla. Okay, so 4 lang ang branches ng nasociliary. So again, what are the 3 branches of the ophthalmic division? Sige nga, can you chat it? Given na isa, we have the nasociliary. What are the other 2? The largest and the smallest. Sige, are you with me? O, sige, mag-chat kayo. Dali. Go. Hello? Hello? Hello?
Doc, nag-chat
Yes.
po kami. Chat box po.
Meron na ba? Parang walang pumapasok sa akin. Nag-Shopee ba ako? Or...
No po, pero nag-chat na po kami
ayan
sa
na.
chat
Okay
box.
na. Frontal and lacrimal nerves. Correct. So, the other branches are the frontal, lacrimal, then the nasociliary. What is the smallest among the three? Unmute na lang pero fast na. The smallest is the lacrimal. Okay. Ayan. Sige, let's continue. So, this is a summary diagram of the first branch of your trigeminal nerve. So again, you have your nasociliary nerve. Okay. You have the frontal and the lacrimal nerve. So if you're done with your activity last time, okay, so these are the parts I should see on your activity also. Okay, so small lang naman ng ophthalmic nerve. So for this module, the bulk or the focus will be the second and the third branch. Okay, so for the ophthalmic nerve or ophthalmic division, it enters the superior orbital fissure. Okay, so if you remember the anatomy of your skull on the orbital region, okay, itong black region na to, yung pahaba, okay, that you see on an anterior view is your superior orbital fissure. Okay, so dyan lalabas yung terminal branches of your frontal, lacrimal, and NC or nasociliary branch. Okay, so remember, okay, what foramen or what fissures lumalabas ang branches of the trigeminal nerve also. Okay, so let's now go to the second branch, a main branch, which is your maxillary division. So this is the purple branch on your screen. Okay, so this branch is also considered as sensory in function. Therefore, majority of the innervations are considered as afferent nerves also. And unlike the ophthalmic division, okay, lumalabas siya in the cranial region through the foramen rotundum. Okay? And it passes out into your pterygopalatine fossa. Okay? So this is a schematic diagram of your maxillary division arising from the trigeminal ganglion. Okay, and yung unang circle dito, if you follow through the nerve, is your foramen rotundum. Okay, so this is just the schematic diagram. So from the trigeminal ganglion, you will notice there's a branch that is going to more towards the superior region. So nag-iisa lang siya. Okay, so later you will see what nerve innervates, okay, this or what nerve is for the innervation of your dura mater. Okay, nag-isa lang yan. And then all the rest are going to the anterosuperior, anterior, and inferior region. Okay, and like the trigeminal ganglion, you will notice a ganglion also, okay, somewhere that branch out from the maxillary nerve. So later we'll see what that ganglion is. Okay, so when we study the maxillary division, para hindi kayo maligaw, we classify it based on its location. So first will be what nerve can you see within the cranium, okay? And then what are the nerves within your pterygopalatine fossa? Also, what are the nerves within infraorbital canal, and what are the terminal branches that we see within the facial region. Okay, so within the cranium, so as I said kanina, isa lang siya, that will be your middle meningeal nerve. Okay, so the one from the main trunk, yung pataas, the one pointing upwards, okay, that is your meningeal branch of maxillary nerve, or simply middle meningeal nerve. Okay, so it supplies the dura mater. With regards to the branches that you will see within the pterygopalatine fossa, okay, we have a number of nerves. So number 1 will be your zygomatic nerve. Okay, and for the zygomatic nerve, it has 2 sub-branches. Okay, your zygomatico-temporal and your zygomatico-facial. So if you will look at this diagram from the main trunk, from foramen rotundum to your maxillary nerve trunk, okay, going superiorly, you will see your main trunk of the zygomatic nerve, and it will divide into two, your zygomatico-temporal and your zygomatico-facial. Okay? So, kanina, we said the zygomatic nerve, okay, joins to a branch of your ophthalmic nerve, your nasociliary. So, ito na yun. Yung isang walang name dito. Okay? But that's still a zygomatic nerve. Okay? So, yung 2 main branches niya, the zygomatico-temporal and the zygomatico-facial, okay? So, yung first, ito, you will see temporal because it goes to the temporal region. Okay? And with regards to the location, it is usually 16.9 mm from the corner of the junction of your eyes. Okay? It supplies the skin on the side of the forehead or your skin over your temporal fossa region. Okay? Whereas for the second branch, the zygomatico-facial, it supplies the skin on the prominence of the cheek. So when, for female, when you do your makeups, okay, I don't know if you realize it, the blush on are placed within this region also. Okay, so for those who has fair complexion, naturally without makeup on, you will notice this is the region where it becomes reddish, pinkish region. So that's what we're trying to mimic when you do your makeup also. So this region, okay, the one on the right side, sorry, this is supposed to be letter B. Okay, that's your zygomatico-facial nerve. Okay, so also within your pterygopalatine fossa, okay, we have the pterygopalatine nerve. So kanina we said the zygomatic nerve. So if we will go back to this one, going superiorly is your zygomatic nerve. Okay, and then going naman inferiorly, okay, this is the ganglion. That's your sphenopalatine ganglion. Okay? So we, for some references, we refer to it as pterygopalatine nerves or sphenopalatine nerve or ganglion. Okay, they are all the same. So it has different branches. So we said a ganglion is like a meeting point of different nerves. Okay, kaya marami rin siyang branches. First branch is your orbital or ascending branch. And then second branch is your nasal or internal branch. Okay. And then we also have your palatine and pharyngeal branches. So later, tignan natin yung sa iba. For your orbital branches or your ascending branch, it supplies the periostrum of the orbit, the sphenoidal sinus, the ethmoidal sinus, and lacrimal gland. Okay? For a while, someone's trying to go in. Okay, let's continue. So, if you follow the direction of your nerves, okay, the orbital branch, it will give you a clue more or less what it innervates. Okay, so again, that's the periostrum of the orbit, the sphenoidal sinus, ethmoidal sinus, and the lacrimal gland. For the nasal or internal branch, okay, it has two sub-branches, the lateral posterior superior nasal branch, okay, and your medial posterior superior nasal branch. Okay, so for your sorry for that. Let's look at it closely. Yan. I hope you can read it in your screen. Parang sa akin medyo maliit. Okay, so for your nasal, again, we said it has lateral nasal branch. Okay, it's the one on the left side. So it runs through the sphenopalatine area to reach the nasal septum. Okay. For some references, they also call it as the short sphenopalatine nerve. Okay. So what does it supply? It supplies the upper posterior part of the lateral wall of the nose. Okay. Whereas for the medial septal branch, okay, so for the medial septal branch, it forms or siya yung start of your nasopalatine or your long sphenopalatine nerve. Okay? So that sphenopalatine nerve, if it moves further anteriorly to the terminal portion, okay? So that's what yung nasopalatine area dito sa harap or the papillary portion here, okay, siya na yung terminal portion. Pero the starting part will be your medial or septal branch. Okay? Okay. So another part or branches of your sphenopalatine ganglion, okay, is your palatine branches. So you have a greater or anterior palatine nerve, your middle palatine nerve, okay, and your posterior palatine nerve. So the greater palatine nerve, so if you will look at the lower photo on the right side, okay, yung yellow, that's your nerves. The red one is your artery. So when we talk about arteries later on, okay, nag-iba lang, same name, different, nakalagay lang na nerve, nakalagay lang na artery. So on your exams, okay, I hope you understand na pag nerve siya, you have to put the name or the word nerve. Okay? Pag artery ang hinahanap, you have to put the name artery. Kasi if you just simply place greater or anterior palatine, okay, is it the nerve? Is it an artery? Yan. So for the greater palatine nerve, you will notice yung fibers niya. It is directed more anteriorly. So the parts that it innervates are your palatal soft tissues and bone in the region of in the premolar and molar regions. Okay, just follow the fibers. So again, your soft tissues, palatal soft tissues, and your premolar molar area. So for the number 2 and number 3, these are both lesser palatine nerves. Okay? And they come and they arise from the same foramen. So for the uh, branch, you have your middle palatine nerve and your posterior palatine nerve. So yung ini-innervate nila will be your mucous membranes of the soft palate, the tonsils, and the uvula for the middle. For the posterior, it is your mucous membrane within the tonsillar region. So, for example, when you go to your higher level subjects like oral surgery or anesthesiology, I hope you will remember these nerves. Kasi for example, you are to extract a premolar. So the question will be, what are the nerves that we are anesthetizing when we are extracting a premolar tooth? Okay, so syempre, one will be your greater palatine nerve. Okay, so that's how you apply it later on. So I hope you memorize this nerve, especially those that are within the oral cavity. Okay. So again, for the palatine nerves, you have your greater palatine and the lesser palatine. For lesser palatine, it has two, the middle and the posterior. Okay? Yan. So kanina, you saw this one, another branch of your nasal nerve, the medial or septal branch, which forms the nasopalatine nerve. Okay, so ito na siya. And pag on its terminal region or branches, okay, okay. So ito na yung elevation on this portion. Okay. So it innervates the floor of the nasal cavity, the mucous membrane over your vomer, and your pre-maxillary region. Okay. So again, we are still at the pterygopalatine fossa. So you have your zygomatic nerve, okay, the parts of your sphenopalatine ganglion, okay, and your nasopharyngeal nerve. So you also have a pharyngeal branches. So it supplies the mucous membrane of the nasal part of pharynx and posterior to auditory tube. Okay. So pag tinignan nyo siya on this diagram, okay, so what are this is your pharyngeal branch, yung palikod na from the ganglion, okay, from the sphenopalatine ganglion. Nakikita nyo ba yung cursor ko? Yes?
Yes
po. Okay, so this is your pharyngeal branch. So kanina, again, sphenopalatine ganglion. You have your nasal branch, yung branch na papuntang anteriorly. Okay, the nasopalatine nerve. Okay, that has that supplies the middle portion area. Then you have the greater and lesser palatine nerve and your pharyngeal branch. Okay. So also within your pterygopalatine fossa is your PSAN, or the posterior superior alveolar nerve. Okay, so it supplies the buccal gingiva in the maxillary molar region, okay, your maxillary sinus, okay, the alveolar region, okay, the periodontal ligament, the pulpal tissues of your maxillary first, second, and third molar. Okay? For the first molar, okay, it innervates the distobuccal root, okay, and pulp. Later, you will see what innervates the mesobuccal root or pulp. Okay? So, why is it important to us? Kasi, again, when you extract any maxillary molar on the buccal region, okay, it is supplied mainly by PSAN, or your posterior superior alveolar nerve. Okay, so for the first molar, it is shared by your MSAN, or the middle superior alveolar nerve. Okay. Ang difference lang nila will be the location also. For the PSAN, it is still within the pterygopalatine fossa. Whereas for the MSAN and ASAN, okay, it is within the infraorbital canal. Okay? So, from the main trunk of the maxillary nerve, okay, let's go back to this diagram, it becomes the infraorbital nerve as it enters the orbital cavity, okay, by way of your inferior orbital fissure. So, kanina, superior orbital fissure is for your ophthalmic nerve. Okay? And then for your for the infraorbital nerve, it is your inferior orbital fissure, and as it goes to the facial region, it will be your infraorbital foramen. Okay, so you can follow that. So, when you look at the skull, okay, when you try to remove this nerve, okay, imagine there will be a depression area there. So, that will be your inferior orbital fissure, okay, your infraorbital groove and canal, and it will exit through the infraorbital foramen. Okay, so remember those parts. So again, going back, the infraorbital nerve, okay, has branches. Your MSAN, or middle superior alveolar nerve, and your ASAN, or anterior superior alveolar nerve. Kita nyo ba? Dito. So, this is the two branches na, can you see my cursor? So, this is your ASAN, this is your MSAN. So, I said kanina that your PSAN innervates your first, second, and third molar. But for the first molar, it is only the distobuccal root, okay, that it innervates. For the mesobuccal root, okay, it is being innervated by your MSAN, or middle superior alveolar nerve. Okay, so when we are to extract a first maxillary molar, on the buccal region, what are the nerves that innervate this tooth? Sige nga, ano ulit? Paki-chat, or you can recite it. Unmute. Okay, on the buccal region, what innervates the first maxillary molar? No. Your PSAN and MSAN, correct. What about on the palatal region? the gingival region, the soft palate area within your first molar. Same tooth pa rin. Ano yung kaninang sabi natin? What nerve? Is it the greater or some branch of a lesser palatine nerve? Greater palatine nerve, correct. Okay, so I hope you remember that. Okay, so now, we go to the branches of the maxillary nerve, okay, that exits on the face. Okay, so going back to your anatomy of the skull, okay, it exits the infraorbital nerve, okay, with the emsan and asan branches, exits the face by means of your infraorbital foramen. Okay, so these branches, okay, are your palpebral branches, the nasal, or your lateral nasal, and your superior labial branch. Okay, so these are the terminal branches. For the inferior palpebral, it supplies the skin of the lower eyelid. Okay, and for the lateral nasal, from the name itself, it supplies the skin of the side of the nose, and your superior labial supplies the skin of the upper lip. Okay? So, for sure, you will not forget what it innervates kasi yung name mismo, okay, gives the clue. So, when asked what supplies the skin of the upper lip, okay, so upper, syempre, superior, lip, labial, so superior labial, okay? So, if we look at this diagram, so what is A? Sige nga, tatlo lang naman option natin. These three. Yan. Based on the location, what's letter A? Inferior palpebral nerve, correct. What's B? Based on its location lang. Sige. Lateral nasal, correct. What's C? Superior labial, o, di ba? Ang dali. Okay, so, for some nerves, medyo bonus point na yun for you. Okay, just try to read and read lang talaga or check atlases. Okay? Okay. So, with regards to maxillary division, we call a network of nerves formed by the three superior alveolar nerves, your pisan, emsan, and asan, as your superior dental plexus. Okay? Pag yung collection of the three superior alveolar nerves, that's your superior dental plexus. And with your superior dental plexus, it has an outer nerve loop and an inner nerve loop. Okay? For the outer nerve loop, it is formed by the three superior alveolar nerves, your pisan, emsan, and asan, after entering the apical foramina. Okay? Whereas for the inner nerve loop, it is a collective term that we use for the nerves that supply the palatal alveolar mucosa, okay, or your entire palate. So we have the nasopalatine nerve and your greater palatine nerve. Okay, I hope you can imagine kanina no, na we've discussed the greater palatine nerve. We said it innervates in terms of the dentition, your posterior molars, okay, as well as the soft tissues above the bony portions, and your nasopalatine area. Okay, so About the maxillary division, and actually for the entire trigeminal nerve, we have what we call as your trigeminal neuralgia. So this is a disorder that is characterized by a chronic pain. Okay? So that's a severe, long-lasting type of pain over the areas where the trigeminal nerve innervates. So a patient will usually complain of an unexplainable pain even with a light touch on these regions, pwedeng on the lower chin, on the upper posterior region, on the maxilla, sometimes on head, like similar to a headache. Okay, it transfers from one area to another. And initially, they will be referred to our clinic because, kunyari, the pain is on the upper cheek or on the cheek area or on the mandible. Okay, other medical professionals will think of it as a pain associated with a dental concern. So once you check the oral cavity or the teeth of the patient and it happens na everything is clear, no cavities, no any periodontal concern, or everything seems to be within normal limits, and there's pain, okay, you may have a tentative diagnosis. The patient may have a trigeminal neuralgia. And with trigeminal neuralgia, we usually refer the patient to a neurologist, okay, someone who specializes in in the nerves, okay. So they also ask the patient to take like carbamazepine to relieve this unexplainable pain. Okay, so the increased sensitivity to pain is what we refer to as hyperalgesia. Okay, so algesia is pain. So hyper, okay, so an increase in pain. Okay, so the pain from a usually non-painful stimulus naman will be allodynia. Okay, so just keep that in mind na sometimes patient will complain of it parang toothache pero pag tinignan mo wala. Okay, now you will know how to inform the patient what are the other conditions. Okay, so that's just one application of your knowledge to your trigeminal nerve. Now we go to the last division, your V3, cranial nerve V3, or your mandibular division. Okay, so obviously, this is the third division of the trigeminal nerve. So unlike V1 and V2, this is a mixed nerve, okay? Mix of motor and sensory innervations. Motor because some of the nerves innervates the muscles of mastication, okay? And later we will see what are these nerves. Okay, so when we study the mandibular nerve, okay, we have the undivided nerve and the divided nerve. Okay, so for the undivided nerve, we have nervus spinosus or the meningeal branch that supplies the dura mater. Okay, and then number 2, we have the nerve 2 medial pterygoid muscle, which innervates the tensor veli palatini and the tensor tympani. Okay, so this undivided nerve okay, is sometimes they refer to it as the common trunk. Okay, so I hope you can see the labels on the photos. Okay, so again, the undivided nerve will be your meningeal branch or the nervus spinosus, and your nerve to medial and lateral pterygoid, because the rest will be divided nerves later. Okay? Okay. Saglit. Nagmo-move ba sa... Can you see the screen? Does it show
Yes,
the
po.
anterior division? Okay. So for the divided nerves, we have anterior and posterior division. For the anterior division, we have the nerve to the temporalis muscle, nerve to masseter muscle, your nerve to lateral pterygoid, and your nerve to your long buccal nerve. Okay? So for A, B, and C, if you will notice, these are your muscles of mastication. Okay? Ang kulang lang dyan will be your internal pterygoid or your medial pterygoid. Okay? Which is considered as yung kanina, which is a undivided nerve. Okay? So let's look at them. Your long buccal nerve is the only sensory branch within your anterior division. A, B, and C is are motor, provides motor innervation. Okay? So for the long buccal nerve, okay, here, it supplies the skin of the cheek as well as the buccal gingiva in the mandibular molar region. So when you're extracting any of the any first, second, or third molar, okay, on the buccal region, you are anesthetizing the long buccal nerve. Okay? And syempre, when you anesthetize, when you have to extract any of that, any molar on the lower arch, okay, mamaya you will see ano naman yung mga nasa lingual area that you need to anesthetize. Okay? So again, these are your anterior division. For the muscles of mastication, kindly refer to, okay, when you study it, go back to ano ba yung function, what is the action of the temporalis muscle, what is the action of the masseter, what is the action of lateral pterygoid, because at this point, hopefully you can try to mix the topics already. Okay? So for the posterior division, we have three branches: your auriculotemporal nerve, the lingual nerve, and your inferior alveolar nerve. Okay? The auriculotemporal nerve has the following branches. Medyo marami. Okay? But majority of these are supplying the ear and temporal region. Okay? So for the anterior auricular branch, it supplies the front of the upper part of your auricle, or simply your skin of the helix and tragus. Okay? Ano ba ang helix? Okay, so here. This is your helix and your tragus region. Okay? Whereas for the articular branch, okay, or some reference books refer to it as anterior articular branch. Okay? So it supplies the posterior portion of your temporomandibular joint. The parotid branch supplies the parotid gland, obviously. Okay, and we have a meatal branch which supplies the skin of your meatus, kaya siya meatal, plus your tympanic membrane. Okay, and then E will be your superficial temporal branch that supplies the skin of your temporal region. Okay, so nasa name din naman yung clue as to what it innervates. So, just a recap for anterior auricular branch. Auricular region, meaning in ear region. Okay, so skin of the helix and tragus. Articular branch, posterior region of your temporomandibular joint. Parotid gland for the parotid branch. Okay. For the meatal branch, again, this it innervates the skin of your meatus and tympanic membrane. Okay. And then for the superficial temporal branch, again, your scalp over your temporal region. Okay. So that's for auriculotemporal nerve. We go to the lingual nerve. So for the lingual nerve, it innervates or supplies the anterior 2/3 of the tongue. Okay? So please take note, not the entire tongue. So kunyari, we have a quiz and then what does lingual nerve innervates? Then you answer tongue, that's wrong. Kasi hindi kasama yung anterior 1/3. Okay? It's only the anterior 2/3 of the tongue, the mucous membrane of the floor of the mouth, the gums or the gingival region on the lingual side of the mandible, as well as the sublingual gland. Okay, so 4 lang yun. And then your inferior alveolar nerve, so this is the largest branch of your posterior division. Okay, and it enters the mandibular canal at the level of your mandibular foramen. Okay. So if we will look into your inferior alveolar nerve, okay, so it has a branch that goes or innervates your dental branches and your mylohyoid nerve, okay, that innervates your mylohyoid muscle, as well as your anterior belly, as well as the anterior belly or digastric muscles. Okay. So when we extract, for example, a lower second molar on the buccal region, what nerve do we anesthetize? Nag-isa lang yun. Sige nga, can you chat it? Hello. Di na maalala. It is your long buccal nerve. Okay? Balikan natin. So from this diagram, okay, this is your main mandibular nerve trunk. We said, okay, ito yung isang anterior division, your long buccal nerve. It innervates your mandibular molars. And then, on the lingual surface, ang mga ina-anesthetize will be your lingual nerve and your inferior alveolar nerve. So, tatlo. Okay? When you're extracting a posterior molar. So, aside from your anterior division, posterior division, your the undivided nerves, we have your terminal branches. So we have the mental nerve, so it exceeds your mental foramen. So on the skull, if you remember, it's somewhere lateral to your premolar region. Okay, so that premolar region extends anteriorly, innervating the skin of the chin, your lower lip, as well as the buccal gingiva anterior to your mental foramen. So Kung ang mental foramen is located within your premolar teeth, okay, therefore, it also innervates the buccal gingiva of the anterior canine, your incisors, etc. Okay? So, anything anterior to your mental foramen, it is innervated by mental nerve. And then we have the incisive nerve, which innervates the pulp of your cuspid or your canine and your four incisors. Okay? Two central and two lateral incisors. Okay? So this just shows the summary of a schematic diagram for your ophthalmic division. Okay, just a recap, we have the frontal, lacrimal, and your nasociliary branches or nerves. Okay, and it has sub-branches. For the maxillary division, okay, we have the following. Okay, if you remember, merong branch that goes to the cranial area, your meningeal division. And then we have the zygomatic nerve. Okay, tas meron siyang two branches. And then we have the infraorbital nerves. Okay, na meron ding branch, the anterior and middle superior alveolar nerve. Okay, PSAN is different yung location niya. Okay? It's different to the MSAN and ASAN. And it becomes your PSAN when it enters your pterygomaxillary fissure. Okay? And then also for the maxillary division, you have your pterygopalatine ganglion or your sphenopalatine ganglion. Okay? And its branches. Okay? Your nasopalatine, greater, lesser palatine, and the pharyngeal branch. Okay? Tapos meron pang mga terminal nerve endings, okay, that innervate some structures within a more anterior region. And then lastly will be your mandibular division. Okay. Similar to the maxillary division, meron nerve that goes to the cranial portion. Okay. Your nervus spinosus, okay, and your another division will be your nerve to the medial pterygoid. Okay, and so on. So you can use this diagram when you try to study, okay, the different branches. Okay, so these are the references, and that ends the lecture for this afternoon. Any question? Ganito ba yung dinrawing nyo sa activity? Okay. So more or less, hopefully makita yung mga main branches dun sa activity nyo last time. Okay, so for next week, we will be having a quiz from module 5 to 7, if I'm not mistaken. Basta yung hindi na-cover nung first coverage ng quiz number 1. Okay, then we will have a long quiz. So, kindly study well for that quiz. Hindi ko pa natapos checkan yung first quiz nyo. Okay. Yung iba nag-struggle. But hopefully, makabawi kayo on the next quiz. More or less, ganun, similar to that pa rin yung quiz natin. Any question?
Ma'am, Monday po yung quiz, no?
Yes. As of now, Monday. Ako lang ba klase niyo ng Monday?
Yes po.
Okay. Gusto niyo ba ng Tuesday or okay lang ang Monday? For the room, I will let you know if we can do it at LV. But for the exam on, by the way, so next week will be a quiz. Okay, then the following week on April 3 ba yung Monday, will be your exam already. Okay, so that's your midterms week na rin talaga yun. Para hindi na sumabay yung iba yung subjects after. Yung exam on April 3 will be announced din kung saan yung room natin. For the exam, usually I provide the paper already for the exam. Not on Canvas. Mataas yung chance na hindi sa Canvas. Pero I'll let you know kung possible din yung Canvas. Okay ba yung internet nyo sa GP? Have you tried having an exam through Canvas sa GP? Yes. For midterms, yes, M1 to M7. Okay, I'll let you know for the exam if it's on Canvas or not. More on identification of landmarks. Parang yung quizzes din natin. Okay, laboratory approach. So, talagang more on identification. Okay, welcome. If no more question, please use the rest of the time to study for next week's quiz. Okay, so for the trigeminal nerve, focus on the branches and what it innervates. Okay. I rarely use different pictures unless we do move exam type of exam, like actual specimens. Okay, if no more question, I will your attendance muna. Okay, Ababaw.
Present po.
Okay, Acosta.